Mr. Jones is in room 212, is 2 days post-op from a splenectomy. We need to get this patient ambulating and he is drinking well. What do you think about removing his catheter?
We don't have an order to remove it. Let's use the Houdini tool to see if there are any reasons why we shouldn't.
Houdini? Sounds like you want to make something disappear.
Yes, we do. It's a clinical support tool designed to help nurses make decisions about catheter removal. If any of these conditions are present, the catheter should be left in.
That means we don't need an order to remove a Foley catheter.
The longer the catheter stays in, the greater the risk for infection. If any of the conditions are present, discuss with the physician. If not, we can remove it. It works the other way too. Nurses can make the decision without an order to insert a Foley catheter. Use the tool, Indicators for Insertion and Removal algorithm.
How do I remember all this?
You don't have to remember it. Search the Inside Net for urinary catheters in adults. The toolkit has all these tools for us to use. This can be found on your unit and will help you to find the toolkit. Let's give it a try. I have a patient with delirium. Her CAM is positive and after completing the Prism E, I think she has urinary retention. What's next?
I did a bladder scan and found 600 milliliters in her bladder, but I can't get a hold of her doctor.
That's definitely reason to insert a Foley catheter. Does she have any urological or gynecological history that may be a contraindication for insertion?
No, I checked the chart. According to the Urinary Catheter Toolkit and Houdini tool, we can insert the catheter without the doctor's order.
Great. We will make sure to include this in our handover communication using iDraw with the next shift.
Oh yeah, I've noticed that stat locks are being put too low on the leg. Let's make sure they are in the right place so we don't cause any long-term damage. It's nice having the autonomy to make these decisions. If I am nervous about the decision or unsure, I will talk to the physician. Last question, can LPNs do this without an order?
Not at this time. It is only within the RN and RPN scope of practice to insert, remove and use UroJet without an order.